Good evening, I'm John Weathers with Global Pulse News. New research may raise concerns for expectant mothers and their children. A recent large-scale study has found that children born to mothers who contracted COVID-19 during pregnancy had a slightly higher chance of being diagnosed with autism or other neurodevelopmental differences. Let's take a closer look. The study, conducted by researchers at Massachusetts General Hospital, looked at more than 18,000 births in Massachusetts between March 2020 and May 2021. Of the mothers who tested positive for COVID-19 during pregnancy, a higher proportion of their children received a neurodevelopmental diagnosis by age 3, including autism and delays in speech or motor skills. Specifically, the study found around 2.7% of children born to infected mothers were diagnosed, compared to about 1.1% among children whose mothers were not infected. It's very important to stress, this study shows an association, not proof of causation. In other words, it does not show that COVID-19 during pregnancy causes autism, only that the two are linked in this data set. Also, while the increase is statistically significant, the absolute risk remains low. Most children born to mothers with COVID-19 did not go on to receive a neurodevelopmental diagnosis. Researchers believe the link may reflect how a mother's immune response to infection, such as inflammation, can influence brain development in utero, even when the virus itself doesn't cross the placenta. At the same time, the study has several limitations. It couldn't fully account for other maternal factors, such as obesity, hypertension, or gestational diabetes, which may themselves affect neurodevelopment. Additionally, the data largely reflect pregnancies before COVID-19 vaccinations were available or widely used, meaning the relevance for vaccinated pregnant women remains uncertain. For expectant mothers, the key messages are clear. Stay informed and speak with your healthcare provider about vaccination and infection prevention during pregnancy. While the risk highlighted in the study is elevated, it is still small in absolute terms. This means most pregnancies with COVID-19 will not result in a neurodevelopmental diagnosis for the child. This study reinforces the importance of prenatal care and monitoring early childhood development if any concerns arise. In short, new research from Massachusetts suggests a link between COVID-19 during pregnancy and slightly higher odds of autism or other neurodevelopmental diagnoses in early childhood. But the findings are not definitive, and more work is needed, especially among vaccinated populations. That's the latest for Global Pulse News. I'm John Weathers, bringing you the pulse of our global health story. Stay healthy, stay informed, and good night.